Alright, so here for yet again another video, we are going to be doing a combination of the cervical and thoracic spine examination. Components from each of them, just kind of doing a pick and choose of what I want to do here. So I'm going to start off with some palpations of the thoracic spine. So some of the anterior palpations for the thoracic spine would begin at the sternum. So you have the most superior portion, which is the manubrium, and you can palpate down for the sternal body. And at the end of the length, you will start to run into some soft tissue, and then you can dig your fingers in and push up, and you'll find the xiphoid process right there. You could also palpate some of the ribs and costal cartilage, so those would be located lateral to the sternal body, and you can palpate each rib as it runs along anterior to posterior, and in between the ribs you will have the costal spaces, that is in between the costal cartilages of each rib. And then I can have the patient turn around and do some posterior palpations for the thoracic spine. So these would include, starting at the scapula, you can just find the scapular border, so that's right about here. You have the supraspinatus muscle, which is in the supraspinous fossa. If you go below the spinal border, you have the infraspinatus muscle. And then right below that, the last one palpable is the teres minor. So those are some of the scap muscles. And then you can find your spinous processes. So as you palpate down their spinal column, there will be those spinous processes that are sticking out, and in between each spinal process is the supraspinous ligaments that hold them together. And then if you palpate lateral to each spinous process, you will find some transverse processes as well. Some other palpations would include the paravertebral muscles, so those run lateral to those and over those transverse processes of the spinal column. So you just palpate along the length there. So those are plenty enough of palpations for the thoracic spine. So I'll have the patient turn back around. I'm going to be bringing them through some passive range of motion for the cervical spine. So for this, I'll be behind the patient. And since it is passive, I'll be supplying the stabilization and the movements myself. So I'll stabilize the head here. I'm going to bring them into cervical extension. So you apply a little bit of an overpressure there as you bring them back. Alright, and then you can do some cervical flexion. So this is chin towards the chest. Bring them down as far as you can. Apply a little bit of an overpressure, don't get too crazy with it. The next range of motion is a cervical lateral flexion. So you can go to each side, seeing how much range of motion they have available, checking that it is equal on both sides, applying your overpressure to assess the end feel. And then we have some cervical rotation. So since this is passive, I will be applying a rotational force, trying to get them to look over their shoulder. Alright, bring them back to neutral. Do the same thing going the other direction, seeing that it is equal, making sure it's fluid. So those are all of the passive range of motions for the cervical spine. Now I'll just be doing a couple tests, special tests for the cervical spine. So the first one I'm going to do is a cervical compression test. So the patient will be in this position, they'll be seated, sitting straight up. I will be applying an axial load to the cervical spine by placing my hands at the crown of their head and pushing down, applying enough pressure to see if they get any pain that would be indicative of some facet joints being compressed. The second special test for the cervical spine that I'm going to be performing is the brachial plexus traction test. So for this test, you'll be in this position. It's a seated position. I will be applying a lateral flexion to one side as I am applying a force on the shoulder going down. So you're making some traction here in the brachial plexus region. What you're looking for is any reproduction of neurological symptoms or pain, and depending on which side they feel it, If they feel it on the side that's being stretched, that is a brachial plexus traction mechanism. If they feel it on the side that their head is being leaned towards, so if she felt it on this side as I'm distracting over here, and she feels it on her left side, that would be a brachial plexus compression mechanism. So the next set of tests I'll be performing is for the thoracic spine. So for both of these tests, I'll be having my patient standing. And the first one that I'm going to be doing is, they're both for thoracic outlet syndrome. So the first one I'm going to be doing is called Allen's test. So for this one, the patient will be in a 90 degrees elbow flexion, 90 degrees shoulder abduction. It will be horizontally abducted about 30 degrees, and then external rotation of the humerus, so kind of bringing them back. It's kind of that cocking position for a thrower. And what I'm going to be doing is palpating the radial pulse, and then the patient will look to the opposite direction with their head. And a positive sign for this test is if the radial pulse diminishes or disappears, meaning that they have some blockage in the thoracic outlet that would cause the radial pulse to disappear. That would be some vascular MOI, or they could have some neurological symptoms, so pain or numbness or tingling that shoots or radiates into the arm, and that would be some neurological thoracic outlet. The next one I'm going to perform is the patient will turn sideways, and the patient will be having their arm in the military brace position, so in this position. Their humerus is externally rotated about 30 degrees. I'll be palpating the radial pulse. I'll be stabilizing here. I'm going to ask the patient to hyperextend their neck, so she'll be looking up that way. And for this one, I will be seeing if that radial pulse again disappears or diminishes, meaning that there is some vascular blocking going on in the thoracic outlet, or if there's any radiating pain down the arm or numbness or tingling, which would be some neurological symptoms. And then that is it. You can hold each test for about 30 seconds to fully assess if any symptoms do arise. So those conclude the palpations, range of motion, and special testing for cervical and thoracic spine. It's a mixture of each one, but hopefully that is helpful, and thank you.